The Nuvant Mobile Cardiac Telemetry MCT system, developed by Corventis, is a technology designed to monitor your heart for unusual activity known as an arrhythmia. Once activated, Nuvant MCT will look for arrhythmias and transmit information wirelessly to the Corventis Monitoring Center. The information is reviewed by the Corventis Monitoring Center and delivered to your physician to help them with diagnosis. Inside each Nuvant MCT box, you'll find one or more wearable PICS devices. One of the two Z-Link data transmission devices seen here, a charger for the Z-Link, prep wipes for your skin, and instructions. Charging the Z-Link. Connect the charger to the Z-Link and plug it into an electrical outlet. For certain geographies, a plug adapter may be included. If the lights on the Z-Link do not light up, push and hold the power button until the lights turn on. During charging, the power light may flash, indicating that the battery charge is low. Keep charging the Z-Link until the power light turns green. This may take up to 6 hours. In some geographies, the power light on your Z-Link will turn blue when there is adequate charge. How to apply the PICS device. The PICS device will be applied to your upper left chest, as seen here. Before application, use an electric razor or hair trimmer to remove as much hair as possible from the intended location. Trim an area slightly larger than the PICS device. Using only the prep wipes provided, clean the skin where the PICS device will be placed and allow it to dry. Do not use lotions or creams on your skin before application. Open the PICS package by tearing at the notch. Remove the PICS device and place it on a table with the arrow pointing towards the right. Use your left hand to grasp the raised portion of the PICS device, seen here, and then turn it over to view the underside. Using your other hand, carefully peel back and remove the tabs. Take care not to touch the gel while you handle the PICS. Bring the PICS device close to your upper left chest. Position the end of the PICS with the arrow pointing upwards just below the collarbone, and then angle the opposite end of the device towards the nipple. To minimize skin irritation, do not place the PICS device over broken or damaged skin. The PICS device can also be applied to you by a family member, your physician, or any other trusted individual. Please remember to position the end of the PICS with the arrow pointing upwards, just below the collarbone, and angle the opposite end of the device towards the nipple. For female patients, it is important to position the top half of the PICS device just below the collarbone and the lower half of the PICS device covering the upper area of the breast. A bra can be worn over the PICS device comfortably. Petite patients can angle the PICS device slightly away from the nipple and towards the left arm for a comfortable fit. Once applied, press the entire PICS device against your skin using the palm of your hand. Then, use your fingers to press the edges of the PICS device onto your skin. The PICS device will turn on automatically, and a single blinking green light will appear on the display. Check the PICS each morning and evening to see if the device needs to be removed. Please avoid strenuous motion, activity, or showering for 30 minutes after you apply the PICS device. It is important to apply the PICS device as instructed. If it is applied incorrectly, you may be required to use another PICS device. Now you are ready to continue with your normal daily activities. The PICS device is water resistant. You may shower with the PICS, but do not submerge the PICS in water by swimming or sitting in a hot tub. Once applied, do not remove and then reapply or reposition the PICS device. If this happens, you may be required to use another PICC. What to do when you feel symptoms. Whenever you experience symptoms such as a fast heart rate, skipped beats, dizziness, an unexpected fall, or other similar sensations, press the black patient trigger button in the middle of the PICC device until you hear a beep. The PICC device will transmit a record of your heart activity to the Z-Link, which will then transmit the information to the Corventis Monitoring Center. In some cases, you may be contacted by the Corventis Monitoring Center to discuss your symptoms. Using the Z-Link. The Z-Link should be within 30 feet, 9 meters, of you at all times. At night, charge the Z-Link and keep it close to you while you sleep. During the day, carry the Z-Link with you using the Z-Link case or holster. Please keep the Z-Link powered on at all times to allow transmission of data from the PICC to the Z-Link. When the power light starts flashing on the Z-Link, it must be recharged. Some patients ask about the other lights on the Z-Link. These are sometimes used by Corventis customer service, but otherwise can be ignored. Removing your PICC device. If 2 red lights appear behind the circle with cross-line symbol on the PICC display, it must be removed. To remove the PICC device from your chest, grasp one end of the device and then slowly use your fingers to push your skin away from the underside of the device. Rapid removal can cause skin irritation. Place the used PICC device into the Nuvant MCT box so it can be returned at the end of monitoring. If your prescription has not yet ended, apply a new PICC device. Please remember to clean your skin using the prep wipe provided, and do not use any lotions or creams before application. What to do at the end of monitoring. Once your prescription is ended, return all of your used and unused PICC devices, the Z-Link, and all other accessories in the box provided. Thank you for using the Nuvant Mobile Cardiac Telemetry System.